I'm Dr. Soumish Sengupta. I'm a consultant urologist. I'm based in Siliguri and I'm associated with King's Hospital in Siliguri. So today we're going to discuss about a very important topic related to men's health, and that is the BPH, also known as benign prostatic hyperplasia. So what exactly it is? It is very common, but very little knowledge is available to the general public.
What is benign prostate hyperplasia?
Basically, what happens is we all males we have an organ known as prostate, which is surrounding our urinary passage just below the bladder. So after the age of 40, there is a gradual increase in the size of the prostate, which may or may not lead to urinary symptoms. So this enlargement of the prostate is known as benign prostatic hyperplasia.
What are the common symptoms associated with this disorder?
So see, patients with benign prostatic hyperplasia usually presents with three symptoms. One is the storage symptoms, one is the voiding symptoms, and the other one is the post maturation dribbling. I'll explain what is. Storage means the patient has problems in holding on to the urine. That means the patient will complain of that I have increased frequency of urination. I have to go to the washroom several times. Number second, the patient may complain of a problem in holding on to the urine when the patient gets the urge. They have to rush to the washroom. This is known as urgency. And sometimes, while going to the washroom, some bit of urine may leak. This is known as urgency incontinence. These symptoms, along with one more, is nocturia. The patient needs to wake up multiple times at night to pass urine. This is commonly labeled as storage symptoms. That means the bladder is having problem in storing urine. The other one is the voiding symptoms. That means the problem during passing urine. For example, some patients may complain of decreased flow of urine, straining or giving pressure to pass urine. Also, that the patient is going to the washroom and it takes 1 or 2 seconds for the urine to start, or the urine is in a form of intermittency. For example, some bit of urine comes out, then it stops again, a little bit comes out with pressure, again it stops. These all things are known as the voiding symptoms. So we've seen what is the storage symptoms, and these are the voiding symptoms. And last is post maturation dribbling. That means after the patient has passed urine, drop urine still falls on his underwear. So these are the three basic symptoms. There are other symptoms. For example, patient may develop retention of urine. That is, patient is unable to pass urine, which is actually an emergency if it is presenting acutely and may require catheterization of the patient. And sometimes also patient with chronic retention. That means the patient's bladder is always full of urine, but the patient is unaware of it. So all the symptoms are together labeled as LUTS, or lower urinary tract symptoms, and are the common symptoms of benign prostatic hyperplasia. This does not mean that all the symptoms will be present in every patient. It is just that these symptoms are such which we are always have to look out for. We ask patients about these symptoms so that we can come to a diagnosis of BPH.
How common is benign prostatic hyperplasia in India?
Basically, not about just India, it is very common, especially in men above the age of 40. So there is an increase in the size of the prostate. But once again, I'm stressing one thing, that the size of the prostate has nothing to do with the urine symptoms. It is basically the urethral occlusion, or the tendency of the growth of the prostate, in which the prostate occludes the urinary passage. So it does not mean someone has 60 grams prostate. Normally it's 18 to 20 grams, but someone has 60 grams prostate, so he will have more urine issue. Someone has 40 grams prostate, he will have less urine issue. That is not the case. So it is basically very common. Usually it is suggested that 60 to 70% of men above the age of 70 has BPH related symptoms.
How is the quality of life affected in patients with benign prostatic hyperplasia.
Obviously, it is disastrous sometimes, For example, one of the commonest symptoms which really bothers the patient is nocturia. The patient needs to wake up multiple times at night to pass urine. What happens is that those patients suffer from accidental falls at night. Those patients suffer from hypertension. Those patients doesn't have proper sleep, so they have daytime somnolence. The other thing is the patient refuses to travel on bus, refuses to travel on public transportation of any kind, because they say that I'm not sure if I wake up and I feel the urge to pass urine, I won't be able to pass urine. So the patient becomes dependent on diapers. The patient always feels that my life is miserable. So the quality of life is really affected with BPH. But the best part is that with such wonderful medicines and wonderful drugs available, we can really make a very significant impact in the quality of life of the patient. And with all kinds of surgical options available to us for patients who are not responding to medicine, the quality of life of the patients can be improved to a significant extent. Thank you.